So you're walking up to the first tee and you're limping a little bit. So your buddy looks at you and says, bro, just get the stem cells. They are way better than PRP. My cousin's chiropractor swears by them. If you've got knee pain and you play golf, you've probably heard some version of this story. PRP in one ear, stem cell shots in the other, and somehow you're supposed to figure out which one of these is going to help get you back on the back nine without limping and without having pain. But here's the reality. There isn't a simple ladder where PRP is the first step or the cheaper option and that the stem cells are the upgrade and then you finally get into real medicine. PRP, bone marrow concentrate, micro-fragmented fat, they are all tools on the same shelf. I choose them based on what your MRI and your exam show me, not which buzzword sounds cooler. My name is Dr. Gayan Poovendran. I am a sports medicine doctor and regenerative medicine specialist, and I've spent the last 15 years helping golfers get out of the cortisone surgery hamster wheel and get back onto the fairway. In this video, I'm going to show you how I actually decide between PRP and bone marrow-based stem cell treatments and microfat-based stem cell treatments, and how you can tell which one is going to fit your knee instead of just listening to your buddy's chiropractor's opinion. One quick gift before we dive in. If you want something that you can use before your very next round, I have built a free 5-minute warm-up guide that is specifically designed for golfers that have knee pain. I call it the Ready for Tee Off guide, and you can grab it right now at readyforteeoff.com. It's a PDF that you can pull up in the parking lot or before the first tee. You do these 6 exercises, you're done, and you're primed and ready for golf. All right, here is the pattern that I see over and over again. Your knee probably started annoying you last season. So you did the responsible thing. You went and saw an orthopedic doctor, you got some x-rays, maybe you even got an MRI, you got a cortisone shot, and the cortisone shot was a miracle. It was fantastic, and it helped for a bit, right? Now, after a few weeks, you're back to grinding through the stairs and you're tightening up on the 16th hole when you should be thinking about your approach shot. On paper, the doctor tells you it's just knee arthritis, but in your head, it's hold on, I'm 50 and I train really hard and I still think of myself as an athlete. Why does my knee feel like I'm 80 years old? The doctor's visit felt rushed, right? 4 minutes, quick in and out. You looked at an MRI or you looked at your x-ray. He says, yep, it's wear and tear. We're gonna try these shots, and when the shots stop working, we'll talk about surgery. What's missing there is the actual map. Where is your cartilage thin? Is there a bone that's angry underneath it? How bad is your meniscus? What does your swing do to that joint? Without that map, the question about whether stem cells or PRP is better is useless. It's just a guessing game. My answer would be yes, they are both better, right? My job here is to line up your picture of your knee with the right tools, not just sell you on a fancy procedure. So let's simplify the toolbox. There's PRP, there's bone marrow concentrate, and then there's micro-fragmented fat. These are different tools for different problems that are still inside this same joint. So here's what each one really is in plain English. PRP is your own blood spun down so that the platelets are concentrated, then injected into the spots that help. What it does is it helps calm inflammation and nudges healing in the joint in the right direction, as well as in the nearby tissues. The bone marrow concentrate, that's our first stem cell type treatment. This is where we get these cells from your bone, and I reach for that when cartilage, and especially the bone underneath the cartilage, are really part of your pain story. Micro-fragmented fat is the other stem cell type treatment that I'll talk about. We take these cells from your own fat. Think of this as a living cushion and support matrix that we put down into a worn down joint. One more thing before I get any farther into this, not all stem cell injections are created equal. The responsible version of this is what we just talked about. Same day treatments using your own bone marrow, your own fat, then process and put back into your knee. Those are cellular based treatments with stem cell like signals. They are not lab grown stem cell drugs, and they still need good evidence and thoughtful use behind them. What I'm much more worried about is the bottled stem cell products that are being advertised really hard right now. These are pre-packaged vials being sold as cure-alls. Those are off-the-shelf drugs that are not approved for knee arthritis, let alone anything else right now, but they're being marketed like a guaranteed way to avoid surgery. So if someone is trying to sell you a miracle stem cell vial for your knee, that is your cue to slow down, ask hard questions, and honestly, most often just walk away. My job here isn't to sell you a magical vial, it is to match a safe, evidence-based tool to the actual damage inside your knee. Now, here's how I actually think about going through a golfer's knee with these tools in mind. Most golfers end up here. Your X-ray shows early to moderate arthritis. There is some joint space narrowing, but you're definitely not bone on bone. Your MRI shows thinning cartilage and an irritated joint, but the bone underneath is not lit up. So your joint is annoyed, not destroyed. When I see that, my brain goes, this is an inflamed and overloaded joint, not a crater. So let's start with something like PRP. But why PRP first? Well, in a lot of real world data, PRP outperforms steroids and most gel shots for pain and function, especially in mild to moderate arthritis. Also, when PRP and bone marrow have gone head to head in that particular patient population, they kind of end up in the same ballpark. Bone marrow doesn't magically turn a good PRP candidate into a miracle case. And then also PRP, it's mechanically simple. It's a blood draw with processing and injection. There's no bone marrow or fat harvesting, and also it has an excellent safety record. So if the chemistry of the joint is off, which means there's inflammation and irritability, and that's the main issue, PRP usually helps cover that base. My internal rule here is, if your knee is inflamed and worn, but it's not structurally wrecked, we can probably take care of it with PRP, and then we earn the right to talk about bone marrow or fat-based stem cell type treatments based on how you respond to PRP first. Bone marrow-based treatments move up my list when the problem isn't just the joint fluid and the cartilage, it's actually the bone underneath. I flip that switch when, number one, the MRI is screaming at me. I see bone marrow lesions or subchondral edema, which are bright, swollen areas of the bone underneath the joint surface. Those tell me that the bone itself is part of the pain story. And in that moment, I'm thinking, well, yeah, PRP talks mostly to the surface, but the bone marrow can talk to the foundation. Number two is you're younger or lean with those deep marrow defects. If you've got those focal cartilage defects or maybe a stress reaction in the bone and not a ton of fat to work with, I don't have to use bone marrow, but I'm weighing in the option of the deeper layers are the story here, and a bone-based signal might be worth the extra invasiveness. And third is PRP helped move the needle, but it didn't fix that deep ache. So I'm assuming that you had a good PRP, which means a really good protocol with the right platelet counts, and your surface pain improved, but that deep inside the bone ache never left. And your MRI is backing that up. That's when the bone marrow shifts from being a theoretical option into something much more real. Now, I'm not treating bone marrow as the premium version of PRP. I'm treating it as the right tool that fits better when the foundation of your joint is part of the problem, not just the roof. Microfat lives in the structure and cushioning part of my brain. So picture this knee. X-ray shows moderate to severe joint space narrowing. The MRI shows cartilage thinning, meniscus fraying, rough surfaces. You complain of a feeling that there's like gravel in your joint by the back nine. Now I'm not just asking, can I try to calm the chemistry of the joint? Now I'm asking, does this joint have enough physical support to handle how you walk and swing? Microfat makes sense to me when the joint is structurally beat up and you need a living cushion and a matrix, not just a tweak to the biology of the joint fluid. If you're over the age of 40 and the whole joint environment is part of your story, if you want something that literally changes what the joint is sitting on. Now, in head-to-head data, MFAT and PRP both improve pain and function. Sometimes PRP edges out microfat on certain scores, and sometimes microfat does better in others. Overall, they're comparable and they're safe. Again, they have different jobs. It's not better versus worse. So my thinking here is, if the main problem is potholes, which means cartilage, meniscus wear, a structural tool like microfat deserves a more serious look. If the main problem is just chemical irritation in a still solid joint, well, then I'm probably gonna say that PRP is cleaner. And yes, sometimes I stack them together. Fat as structure, PRP as fertilizer. When the joint is both beat up and inflamed, that combo can make a lot of sense. Here is the shift I want you to walk away with. Stop trying to answer the question, is PRP or stem cells better? Start asking, what exactly is wrong inside my knee and which tool is going to fit that picture? When you do that, in an early to moderate, mostly inflamed joint, you're more likely to start with a PRP, which is the simple, well-studied option, and That often gives months of real relief. In a knee where the bone lights up on MRI, you're asking smarter questions about the bone marrow-based treatments instead of just repeating surface level fixes multiple times with little movement of the needle forward. In a structurally beaten up joint, you can say, should we talk about a fat-based structural approach instead of just more fluid shots? And you stop being the guy who gets sold premium stem cell packages and you start being the guy who asks the question, show me where this matches my MRI and my goals. If you don't make that shift though, then you're gonna stay in marketing fog. You bounce from cortisone to other shiny injections to surgery consults, and the map of your knee never really changes until you get it replaced. And the only thing that really changes is your bank account. The win that I care about here is very simple and very specific. I want you to be able to say yes to that golf trip with your buddies in Scottsdale or Inverness or wherever you want to go without having to worry about your knee. I want you to be able to walk 18 holes if you want to with the same stride that you started with. I also want you to still feel like the athletic version of yourself, not the my knees are shot and I have joint pain version of yourself. Now, one thing you can start right now before your next round, no matter what treatment you end up choosing. This exercise is called rotation over fixed foot. What you're going to do is you're going to plant your lead foot firmly on the ground. You're going to put a club across your hips and you're going to rotate your hips left and right over that fixed foot, keeping your foot flat. You're going to do 10 smooth repetitions to each side. The cue I use here is that this is going to load your lead knee and it's going to do it in a way that's similar to what it sees at impact without the ball or the speed. You are going to teach your joint how to handle rotation with control before you go full set. Now, most golfers I know, they try to fix their knee pain with injections and they ignore the fact that their swing is hammering a cold, stiff joint. This exercise is one thing that will help change that. Now for the rest of my 5-minute routine, again, 5-minute routine, 6 exercises, go grab the free Ready for Tee Off guide at readyforteeoff.com. It has all 6 exercises with pictures and you can pull it on your phone or pull it up on your phone in the parking lot. Nobody has to see you. So if this cleared up the question for you of PRP versus stem cells, look, there's probably somebody in your group, in your foursome that is quietly dealing with the same knee story. Send them this video. Send it to them before they sign up for a random shot or they start rushing into surgery that they may not need. And again, don't forget, download that Ready for Tee Off warm-up guide at readyforteeoff.com or send it to them, have them download it. The 5 minutes before your round can truly impact the rest of your day. 5 minutes, that's it. Your knee will notice the difference by the time you walk to the first tee. I'm Dr. Gayan Poovendran. Now you know what most golfers never find out. I will see you hopefully next time pain-free on that fairway.